Hello, I'm Dr. Bill Gradishar from Northwestern University, and I'd like to talk to you today during this video about aromatase inhibitor therapy and fatigue. So first of all, aromatase inhibitors are very commonly used as a treatment for hormone-sensitive breast cancer. They're used both for patients with advanced disease as well as for patients with early stage disease if they have hormone-sensitive breast cancer. And these are pills that are taken by mouth. In today's era, they're often combined with other targeted therapies, but my focus, or at least the comments I'm going to make, are really related to the aromatase inhibitors. And first of all, why would a patient be taking these drugs? First of all, what they do is they really, in essence, decrease the amount of estrogen that your body makes. Aromatase inhibitors are used in postmenopausal women. They don't work if you give them to a premenopausal woman unless you render her postmenopausal either by removing her ovaries or by suppressing her ovaries, perhaps with a shot that fools the brain into signaling the ovaries that they should stop producing estrogen. And in that circumstance, an aromatase inhibitor can be used. So they've been proven to be very effective in reducing the risk of recurrence for patients with early stage disease, and they've also been shown to be very effective agents for those with advanced disease or metastatic disease. And the other thing about these drugs is because they're effective, patients often stay on them for an extended period of time, sometimes measured in many years. So what are the consequences of being on these medications aside from their therapeutic benefit? Well, they have a whole list of potential side effects as any drug does, but the key things that we make patients aware of when they're taking these drugs are sometimes they cause fatigue. And aromatase inhibitors have been known to cause fatigue. Part of that is their effect. One of the other side effects they have is they can cause achiness in your joints. And with that, patients tend not to want to move around as much. They may feel some discomfort. Not all patients experience that. They can get some stiffness in their joints. And with that, patients simply don't want to move. And if you're less active, it's sort of a vicious cycle. If you have achy joints or you don't want to move around, you're sedentary, you become more sedentary, you become more fatigued. And it's always the counterintuitive thing that I mentioned earlier, that when patients say I'm tired, the first thing I say is you got to get up and exercise. And again, exercise may mean different things to different people, but you start out gradually and try to increase it as time goes on. And with it, your exercise capacity will go up and your fatigue will go down. So what's one of the first things we tell patients when we talk to them about the possibility of either getting fatigue or achiness in their joints? We tell them to move more. So it sounds somewhat counterintuitive if you're not feeling like doing it. It's exactly what we tell you to do. Get up and move around. Exercise. And I think that's critically important because you want to build up your exercise tolerance. You want to be able to affect not only your joints by the activity, because most patients will state that, I feel stiff in the morning, but once I get going, I feel better. And that's not only their joints, but their general sense of well-being and their level of energy. Now, many patients simply don't exercise. I shouldn't just attribute that to patients. Many people who live in the United States don't exercise at all. So it's not as though a patient is the only one that should be doing this. You should get up and move. You should build your exercise tolerance. And most patients don't start out by saying, I'm going to go run a marathon. I often tell patients that if they can, start out, if they're only sedentary, they don't do anything, just getting up and moving around, walking down the block. That's a starting point. And I think as you start out slow, you can escalate it. Your exercise capacity, your ability to exercise will increase as you make it part of your daily routine. And for each patient, the level of activity that they can undergo is different. Some patients are in much better shape than others, so they may view running as what they want to do. So it all depends where your starting point is, but the key point is to get started and keep moving. The other important thing that I tell all patients is that it's not just moving your legs, it's also you have to build muscle mass. and that's critically important too. So, again, I don't tell patients go buy barbells and become a power lifter. I tell them that they have to start doing strength training, resistance training. You can do that with bands, you can do that with light weights. There are a variety of things, and you can build your exercise capacity and muscle mass by doing things gradually over time, legs and arms, and increasing your mass. And that helps in terms of not only the achiness that some patients experience in joints, but also it just helps overcome the fatigue that many patients experience. The other thing that can be done is, sleeping well. And again, there are multiple reasons why people don't sleep well. They can be under stress. They could have medications that they're taking that rather than help them sleep, actually cause them to be agitated, and they have more difficulty sleeping. So you have to try and make the environment that you sleep in as conducive to sleeping as possible. And you'll hear your primary care doctor tell you to avoid caffeine late in the day, diminish screen time around the time you go to bed, shut off the lights, make the room cooler. All of those things may contribute to a better night's sleep. And then, of course, things like diet as well can influence things. And I should also say that, in this era, a lot of patients are on GLP drugs, so they're trying to lose weight. But again, diet is important. You don't want to avoid eating, and you want to make sure to maintain muscle mass, you have to have a diet that actually is well-rounded and hopefully will help increase your muscle mass. So it's not just eating, but the composition of the food you eat that's important as well. So diet is critically important, and all of these components together may result in decreased fatigue if it's associated with the use of aromatase inhibitors. If you'd like to learn more about your personal situation, you can go to yerba.com, where you have the opportunity to get the input of experts in the field, understand the pros and cons of all the therapeutic options, and hopefully that'll make you more familiar with your situation. Some patients experience fatigue, obviously, just, you go to work, you go to school, you take care of your family, your kids, you're tired. So we're talking about something above and beyond that. And of course, if you have a diagnosis of breast cancer, you have a mental fatigue that comes with that as well. So all of these things are additive, and then you throw a medication on top of all of that, you may have an excess fatigue above and beyond what you might expect from your normal routine. So I think understanding that, again, it's not all your fault, and it's not necessarily something you can completely overcome with one simple solution. You have to look at all the elements that can contribute to having difficulty, maintaining your energy level and overcoming some of that fatigue. So I think it's important to recognize not only the normal things in day-to-day life that can contribute to fatigue, but also to realize that many of the medications that patients take with the diagnosis of breast cancer, including aromatase inhibitors, can also cause some fatigue. So I hope this video was helpful to understand that in patients taking aromatase inhibitors, there are a variety of things that one might experience. Of course, we want the benefit of the drug, but we also acknowledge that there can be side effects as well. So we're talking today primarily about fatigue and the ways that you can overcome that.